This is parasitic blepharitis. So typically it's caused by head louse, theriasis palpebrum, and pediculosis or demodex blepharitis. All these are different ways of explaining this condition. So these patients can have chronic blepharitis and chronic follicular conjunctivitis. So what you're seeing here is the nits, that is the egg of the louse. It's adherent. These nits, this pearly white opalescent areas are the nits that are adherent to the lash margins, and this can be very troublesome for the patient. We can do a mechanical removal, or we use antibiotic ointment, and 1% yellow mercuric oxide is used, or we can delouse the patient to prevent recurrences. Eyelash deformities can be trichiasis, distichiasis, madrosis, trichomegaly, or poliosis. The grey line, just to redefine, is the border between the anterior and posterior lamellae. Meibomian gland orifices are anterior to the mucocutaneous junction, but just posterior to the grey line. When you say eyelash ptosis means drooping of the, ptosis basically means drooping of the eyelid. Eyelash ptosis is drooping of the lashes. So that is typically seen in floppy eyelid syndrome, or in dermatochalasis, or in facial nerve palsy, long standing facial nerve palsy. So this is trichiasis. You can see here there is an inward misdirection of the cilia with the normal eyelid. So this cilia, these eyelashes are directed towards the cornea. They are abrading the cornea. So when it abrades the cornea, it can result in a corneal ulcer. It can be quite a dangerous problem, because constant corneal abrasions can, if it gets infected, it can become a corneal ulcer, and it becomes a whole lot of antibiotics to use in order to heal the corneal ulcer. So this is inward misdirection of cilia with normal lids. You can have chronic blepharitis. Trichiasis can occur in chronic blepharitis, in trachoma, in ulcerative blepharitis, in membranous conjunctivitis. Patients after hordeolum internum, there can be distortion of the glands there. Is particularly common following mechanical injuries and burns, following scarring of eyelid skin, and also very common in patients who have had herpes zoster ophthalmicus or Stevens-Johnson syndrome. Stevens-Johnson syndrome is one of the cicatrizing conjunctival and cicatrizing lesions on the lid or conjunctiva that can also cause a misdirection of eyelashes. Now, misdirected cilia can cause reflex blepharospasm and photophobia. The moment a patient with trichiasis presents to you with photophobia, you know that there has been some irritation of the corneal nerves, and corneal aberration is already there or very likely to develop. So, trichiasis can occur even secondary to an entropion. Primary trichiasis means there is this misdirection of eyelashes. And secondary trichiasis means the entire eyelid is turned inward, that is entropion is resulting in trichiasis. So there can be two reasons. And how do you treat epilation? Epilation means you're just removing the lash at the follicle. It can be done using electrocautery or by cryotherapy or by using laser. There are three modalities of performing this epilation, or you can do a surgery. Distichiasis means an extra row of cilia are occupying the meibomian gland position. So cilia are directed backward. So this is what you're seeing here. This is actually the position of the meibomian gland orifices, but instead of the meibomian gland, you can see an extra row of eyelashes. This is a normal eyelashes. Extra row of eyelashes is developing. This is called a distichiasis, and it can be due to congenital or acquired causes. If it's congenital, the germ cell layer, instead of developing into a meibomian gland, is developing into a pilosebaceous unit. So that is the congenital distichiasis. In acquired, there is a metaplasia of the meibomian gland, there is a metaplasia of the meibomian gland into hair follicles. So, if it's acquired, it can occur following cicatricial inflammation. Again, cicatricial inflammation can occur in trachoma, following chemical burns, ocular pemphigoid, or Stevens-Johnson syndrome. These are the commonest. Any cicatricial inflammation is due to chemical burns, Stevens-Johnson syndrome, trachoma, or ocular pemphigoid. These are the most common causes of cicatrization. Again, treatment is epilation.